Dr. Schurhamer here. Thanks for logging on to learn a little bit about vasectomy. You're probably watching this video because you're interested in getting a possible vasectomy. Hopefully this video answers a few of the questions that you may have, and I look forward to further consultation with you in clinic. So what is a vasectomy? A vasectomy is a procedure where we go in and actually excise and cut out a portion of the vas deferens. Vas deferens connects your testicle to the back of your prostate and allows you to have children. And it actually is the tube that carries the sperm from your testicles up to your vas. And so we go in through two small scrotal incisions, pull up the segment of the vas, excise a portion of it, and then would address both ends of it to make sure that the two ends did not grow back. Procedure is safe and effective, and the recovery entails scrotal support, so that's rolling up some towels to sit under your scrotum, icing, and rest for the first 48 hours. The more that you can do the rest for the first 48 hours after the procedure, the better off you'll be. Once you're able to rest for that period of time, then you can see what you feel comfortable with after that. Side effects from the procedure are rare, but do happen. I want you to be informed about these before considering. Main things that we see are sperm granulomas, so that's just a little knot of tissue that grows at the vasectomy site. Possibility of pain afterwards, so this can develop in the first month to up to a year later. Rare, but does happen. And more commonly, we do just see swelling, so that's where the scrotum itself, just due to edema and whatnot, would increase in size. We can work with you through all these things and make sure that you're well taken care of if any of these things would come up. We perform these in our outpatient surgery center, and we can do the procedure under local or with sedation. So under local anesthetic means just injecting the area sort of like at the dentist, where the dentist would numb up your teeth in the area where he or she is going to work, and we can do the same thing with the vasectomy. So we would numb up the area well, and the benefit of that is you can drive yourself to the procedure and you can drive yourself home the same day, and there is no NPO requirement, meaning you can eat throughout the course of the day. If you're going to get the procedure under sedation, we can provide that as well. The anesthesiologists here typically use a twilight sedation, or what they call MAC. It's what would be typically used for a colonoscopy. And if there's any questions about the sedation and whatnot, the anesthesiologist would be able to answer those on the day of the procedure. And with the anesthesia, people choose that if they're anxious about the procedure, and would allow them to get the procedure, and then they would need a ride home that same day. We do ask that you get a semen analysis either 3 months or after 20 ejaculations. This would help us make sure that there is no possibility of any semen and sperm that was left in the proximal segment of the vas above the area where it was cut, and could help us confirm that you are truly sterile after the procedure. These are just some common questions. I also encourage you to watch the rest of the videos on this page. However, these are some common questions that men have had previously. So the volume of your semen or of your ejaculate does not change after vasectomy. The amount of sperm in your overall ejaculate is less than 1% of the volume, and so therefore you won't notice a change in the consistency or the quality of your overall ejaculate. You can get a vasectomy reversal in the future if you would choose to. There is a possibility of getting sperm banking before the procedure if you're interested in that. And then, vasectomy does not have any effect on your sexual function, libido, or anything like that. Your testosterone levels and whatnot are the same from before and after the procedure, and there's no effect on that. And you are safe to have sex afterwards, assuming that your pain is under control, as early as you would like. You're not safe to sort of have unprotected sex until the semen analysis returns, either 20 ejaculations or 3 months later, with showing that there's no sperm left. Anyways, I hope this video was helpful to you. and I look forward to having further discussion with you in clinic. And feel free to look at the rest of the questions on this Well Prep page to potentially go over any other questions that you may have. Thanks so much.